This is a panel discussion unlike anything you've ever experienced. Here's how it works. Pecha Kucha, it's a presentation style in which 20 slides autoplay for 20 seconds each, and these folks don't control their slides.
I'm going to use my time to push us a little bit. Plus, I just wanted to start with a picture of 3 of my granddaughters. So I'm not sure how far ahead my colleagues looked into the future. I know I'm terrible at long-term projections, so I limited myself to the next 3 to 5 years. I bet my colleagues will be more visionary. My thoughts, I'd describe them as practical. To look ahead, I thought about the current state. I see our hospitals filled with amazing people who have dedicated their careers and to some degree their lives to helping families in some of their most stressful times. Families are desperate for help, and our people want to help. But as I look around, I see our people are not doing as well as we want them to do. In reality, they're struggling. Surveys and data show that about half of our staff and doctors are in or near crisis. They tell us they're stressed or burned out or struggling with their mental health. We are in the people business. Essentially, we are people trying to help people. Yes, we need technical expertise and technology and supplies, but the experience of families almost always comes down to the intimate interactions with our people. So as I contemplated the future of experience for our patients and families, I ended up contemplating about the experience of our staff and physicians. My thought was that if we can help our people be their complete selves, then we'll be able to create the experiences they want to create and those that families need. Therefore, despite the very clear instructions from Richard Corder, I am not going to speak about the future patient experience. Instead, I'm going to speak on the experience of our staff and physicians. As I look at the current state, I ended up focusing on 3 areas. I'd like to highlight these 3 areas and focus on caring for the caregivers. It is so sad to say, but there is a significant increase in the number of incidents of our staff being assaulted while at work. Yet, yes, there are the headline-grabbing news of shootings and deaths and severe injuries, but there are also events which occur every day involving physical and verbal abuse of hospital staff. So, my first area of focus is the reality in 2024 that there truly is a significant problem with violence in the healthcare workplace. Many of our staff are afraid. This is on their mind, and it may be on their spouse's mind and their family's mind. Fear of being hurt is causing people to leave healthcare. It is quite a challenge to focus on others when you yourself are afraid. But there are definitely things we can do. Many hospitals, and likely your hospitals, are taking positive steps. Weapons detection systems, zero-tolerance approaches, codes of conduct, response teams, and more. The staff and physicians feel it when their hospitals take positive steps. I love working in children's hospitals. We really are different. But I do need to be honest. We still have issues with hierarchies, with power gradients, and with unacceptable behaviors. And as a physician and a hospital leader, I have to admit, we own this. Many of our staff do not feel respected. So the second area of focus I want to speak on is psychological safety. This topic often comes up in patient safety as critical to prevent errors and reduce harm. This is absolutely true, but I am referring to everyday interactions in meetings, on rounds, or working in clinic. Our staff, particularly our younger colleagues, don't feel respected. But again, there are ways to improve psychological safety, and most of our organizations have worked on it. But the reality is you're never there. It is something we need to work on day after day, year after year. When staff feel respected, they can give the care they want to give. And finally, having safe environments and appropriate behaviors are important, but something has happened in healthcare over the recent past. Too many of our staff are not okay. They're telling us in surveys and feedback sessions that they're struggling with mental health issues. And a not small group are thinking of quitting the profession. So the third focus area I need to talk about is burnout. And I know some don't like that term. Whatever we call it, it's happening. Why? It's hard to be sure. This is tough work we do. And day after day or night after night, it seems the work is taking a toll. Perhaps this is still related to the pandemic. Whatever the reason, we need to help our caregivers. My assertion is that part of running a hospital now and in the future will involve focusing on the wellness of our clinicians and staff. We have appointed our first chief wellness officer. She has a team and resources just like the other domains of quality and safety. At first, I felt a little strange speaking about our staff when I was clearly asked to speak about patient experience. But when I walk around our hospital and I listen to our staff, I'm constantly reminded caring for others is their calling. It fulfills them. We need to help them fulfill their purpose. Yes, I spoke of workplace violence, psychological safety, and burnout. But I see the future experience for our people will be one where they truly feel physically safe every day. Their voice is deeply respected, and their well-being and health truly matter, and they can feel that. So I have an undying belief in the individuals who choose to work in a children's hospital. Many have wanted to do this since they were a kid. I feel it is a privilege to be in a role where we can create the systems and culture that allow them to thrive. As we do, these amazing people will continue to create amazing experiences. So as I think about the future, I'm optimistic, but I'm also realistic. We have work to do. We should do better, and we will. We are blessed to do this work, helping families and our staff in their time of need. What could be better? Thank you.